Which condition is a contraindication for digoxin?
Which goal is most appropriate for a client discharged after appendectomy?
Which condition contraindicates the use of RTPA? A patient is admitted as a case of suspected appendicitis. Patient verbalized he didn't have bowel movement in the past 2 days and requests for laxative. What is the risk of giving laxatives to a patient with suspected appendicitis?
Which of the following diagnostic tests is definitive for TB?
Which medication is commonly used to treat nephrotic syndrome? Which side effect is associated with isoniazid?
Which medication is most likely given to dissolve a thrombus in a patient with MI and ST elevation? The nurse is receiving a child postoperative tonsillectomy. Which of the following nursing actions is suitable for postoperative care? A doctor is explaining to a patient's mother about the antipsychotic medication of the patient. Which of the following is an example of atypical antipsychotic?
A nurse in surgical unit is preparing for a wound dressing. She sneezed without a face mask on. Which of the following is the most appropriate action?
What is the primary use of atropine in cardiac emergencies? A 17-year-old arrives with right lower quadrant pain and rebound tenderness. What is the highest priority intervention?
A client presents with hypocalcemia, hyperphosphatemia, muscle cramps, and positive Trousseau's sign. What diagnosis does this support? A patient with morphine overdose has respiratory rate of 8 and oxygen saturation of 86%. What should the nurse administer immediately?
A post-coronary artery bypass graft patient has potassium level of 6.8 millimole per Li. What medication is used to reduce potassium?
Which IV fluid is appropriate for a child with diarrhea and vomiting? Schizophrenia is associated with excess levels of which neurotransmitter? The nurse assesses a client with ileostomy for possible development of which of the following acid-base imbalances? Which of the following statement by the nurse about Clomid is true? A COPD patient on Asmacort reports stomach upset. What advice should the nurse give? A nurse working in medical unit is going out with droplet precaution in place. What is the correct sequence for putting the equipment off? Which symptom indicates lithium toxicity? A nurse is taking ECG for a patient. The ECG shows absent P waves. What is the nurse's initial action? Head nurse sends report to supervisor. Which of the following types of communication is this?
A physician gives order over the telephone for stat arterial blood gases. Which of the following is the best intervention to be implemented?